Hi, I am Dr. Richard Camino Gastambide, and I am the Director of Psychiatric Education and Training here at the General Psychiatry Residency Program in Augusta, Georgia. Although not here in this presentation, Dr. David Williams, our Associate Director of Training and Education, and participated in the presentation that we are presenting to you here. So we want to thank you of your interest in knowing a little bit about our program, and hope that you feel that this might be a good fit for you. One of the things that is important for us is the how much diversity is embedded into our program, because we are firm believers that diversity enriches our program and enriches each one that belongs to there. And so this photo, which is the photo that we took last year of our residents, you can see clearly that we are very proud of how much of a diverse residents we have. And this has continued also throughout this year. And one of the things is that also we emphasize not only in a diverse residency group, but also a diverse faculty and staff group. Augusta, Georgia is located on the banks of Savannah River. And the Savannah River in this area specifically of Georgia divides between, you can see on the right, South Carolina, and on the left, Georgia. So we are in an idyllic situation where we can share with resources just across the bridge in South Carolina, and at the same time enjoy the resources that Georgia provide to us. In this map, you can see that Atlanta is about 2 hours west from Augusta, Georgia. We're about 1 hour south from Columbia, South Carolina, about 2.5 hours south of Charlotte, North Carolina, about 2.5 hours from Charleston, about 2.5 hours from Savannah, Georgia. So what this gives you is that you are not only surrounded by what Augusta can provide you, but really within striking distance, you have really major cities and major tourist area where you can really enjoy and have a weekend or participate in activities, maybe even the same day. One of the things that we are very proud of is uh, that our commitment to our community. And our residency program is partnering with the Harrisburg Family Healthcare Clinic, along with other institutions, to provide mental health care to our indigent community. And this is going to occur at a place called the Hub, which was built with about $10 million funding from different local institutions that provided the funding to also give back to the community. So you can see here that this is a photo of the hub just newly constructed. There are a lot of activities that are happening here at this facility, and one of them is that the Harrisburg Family Health Clinic, which is a free clinic, is now being run by the Family Medicine Residency Program of the Medical College of Georgia. We are in partner with them, and from December on, we will be starting to provide weekly free mental health services to those in the community that go there once a week. In addition to that, we are going to partner with a group of social work therapists, which will provide psychotherapy and support to the patients in the community that we have there. The free mental health clinic, I want to say very proudly that it was not an idea that came from the upper echelons of our institution, but it came from an initiative of residents, specifically one resident. Her name is Nora, Dr. Nora Isali, which she already graduated, became an addiction psychiatrist, and really has left us with a very important legacy of serving the community. The free mental health clinic first started as a monthly clinic after hours in our own place at Stony Building. And I am very proud that now we are moving into a really bigger facility in connection with a family medicine group and giving services to the community more often, where now is becoming an obligatory rotation for the fourth years to participate and do 1 year in that clinic every Tuesday. So this is something, again, that we're very, very proud of. One of the things that people are ask themselves is, how well is the teaching? And not the most important component, but an important component is how well do our residents do on standardized testing. And the PRIDE, which is the Psychiatric Residency in Training Examination, is a way to measure how well our residents compare to the rest of the nation in the area of standardized testing. So you can see here that in 2009, we were not doing really that well with our test takers, in the 30th, no more than 40th percentile if you look at 2009, 10, and 11. But if you fast forward to 2017 and on, what you are seeing is a dramatic and a consistent well performance of our residents, including in 2018, we were scoring in about 78th percentile nationwide, and as a total over the 70th percentile. And years after that, we are consistently over the 60th percentile doing when we compare to the rest of the nation. One of the things that you might ask, and I think it's a good question to ask, is, well, are we having, a few strong, residents that are pushing the scores upward? So there's a way to knowing, and it's looking at breaking this a little bit better. When you look at the scores, what you can see is in orange is how many of the group, what is the percentile of the group, what percentage of our residents score less than the 30th percentile. And then on the, I'm going to call it violet group, we are looking at what is the percentage that score over the 70th percentile nationwide. So you can see in 2009 that almost 70% of the residents were scoring below the 30th percentile, and no more than 16% were scoring over the 70th percentile. But let's fast forward, in the last 3 or 4 years, and what you can see is that over 50% in general of our residents are scoring over the 70th percentile, with only 1 or 2 residents, that's what 4% and 7% means, 1 or 2 residents only scoring below the 30th percentile. So what you are seeing is that our residents as a group are really performing as a group very strongly, and this is not just 2 or 3 that are doing very well. This is the price score through classes, PGY1, the first group, PGY2, second group, PGY3, and PGY4. What you can see is there's a consistent in execution, and appropriately, you're seeing the PGY3s that seem to be struggling. Well, what is really happening is that, your second year is the toughest year, and your opportunity to study as much as the other groups can study or hitting the books is a little bit more compromised. What also you can see is that those that are starting the fourth year, when they took their price, really were scoring extremely well, over the 90th percentile. So this is something that again, I think emphasizes the strong performance of our group. So there are other ways that you can measure the program's functioning, and the ACGME, which is the accrediting institution for all residency programs, has a survey. This survey, I, as a part of the administration, have no access to it. I have access to the results. This is sent directly to the residents. The residents have to answer them, and we have no idea what they're going to answer. And our experience is that they're on top of it in the sense that they say what they feel. The response rate is usually very high. And in 2022, what we are seeing is how the residents evaluate our program. Where do they evaluate it as a very negative, somewhat negative, neutral, somewhat positive, very positive? So we have in 2022, we have one person that is that's the 4%, that more or less, and we don't know who that person was, but it's for us it's important that they manifest whatever they think. It's that it was they see it somewhat negative, and if you look at the somewhat positive and very positive, what you can see is that when you combine them, over 96% have a positive view or very positive view of our program. What is the overall opinion of our program in the sense, and I love this question, would you choose our program again? This is a great way to ask somebody, do they like or not our program? 0% did not choose that they would not go again. You have about a 70% that might or might not choose again, but you have a 38% that will probably, 46% that is definitely. So the yay sayers that are strong, it's over 80%, 85% that they feel that they would definitely or probably choose our program. And when you look at the national means, which is the national means, which is the mustard triangle, we basically are on par with that. So what about our compliance from residents' point of view? So what do they think about resources, professionalism, patient safety and teamwork, faculty supervision, evaluation, educational content, diversity and inclusion, clinical experience? When you look at all of that, clearly up to par to the national standards, and we feel very good about this. If you had any questions of, how truthful people answer this, I give this as an example because this is a dramatic example of how people really put there what they feel. In 2017, with the same question, what was the overall evaluation of the program? When we look at 2017, 14% had a negative opinion, 38% had a neutral opinion, 33% had a positive, and 14% have a very positive. Wind out forward to 2022, and only 4% somewhat negative, 25% someone positive, very positive 71%. You can see that in the first, in the upper evaluation, the blue triangle is really significantly below national means. When you look now where we are within and maybe a little bit over the national means. So that tells you that not only residents are telling what they feel and how they think about the program, but that there has been a very positive feeling that the program is delivering what they are expecting and hopefully even a little bit more. In specific questions, these are for residents that are going out. They put specific questions to them. So let me just give you 4 of them. For general psychiatry, how adequate were the clinical experiences you received in emergency psychiatry? And 100% felt that they had a lot. So the residents that are graduating felt, we have been trained quite very well and has had a lot of experience in emergency psychiatry. The other question, to what extent did your training prepare you to provide a variety of psychotherapeutic interventions? So psychotherapy, 60% quite a bit, 40% a lot. And I am very proud of this in the sense that this is a significant improvement. We really have honed in on developing and help residents developing psychotherapeutic interventions. And what we're seeing is that they're feeling and they're seeing that, yes, we have been doing that task. To what extent was your training environment one of dignity and respect? 100% thought a lot. And lastly, did your training program provide you with sufficient clinical experience to practice psychiatry independently? 100% answer that it did. So these are things that are give us a good feedback of what's going on. Several years ago, one of the things that helps or makes it difficult for a program to maintain accreditation is how well are they doing in their board. So the APBN requires that all graduates from a program that when they take the test the first time, at least 70% of them passed. We were not doing that. But when you look at from 2019 till present, what you see is a significant and very positive shift. And when you look at the numbers of the last 3 years of all that have attended and passed, you have 86% that passed, and last year 100% passed their boards. So we feel that training here and passing the board is something that it goes hand in hand, and we feel very good about this. One of the things that we are very proud of too is our structure in our residency organization. And one of the things that you see is that there's not one chief resident, there are 2 co-chief residents. And one is even a PUI 3, the other one is a PUI 4. And so they can really lower the burden for each one. But not only that, residents are involved in the curriculum and the coordination of the curriculum, who's going to give what talk, they discuss with me the topics and everything. We have a committee and chair for that. We have a committee for wellness. We have a committee for social activities and also for recruitment. And this is something that I feel very strong about. The ambassadors of our program are our own residents. They're the ones who are going to tell you about it, and they clearly feel very open. And this is the way that I have been working with them. That say what you think. I think that honesty is the best thing, and because they know that we're trying to do the best to provide an educational environment that is not only one of dignity, but one that produces diversity, enrichment, knowledge, and an attitude of compassion toward our peers, staff, faculty, and patients. This is the PY1, and again, just stressing that you can see the diversity that our program provides. As you know, on your PY3, you can apply to a child program if you desire to do so. And last year, these are three of our residents that went up to do a child psychiatry. And although we have a child psychiatry program, many of them wanted to be back to their homes, in which we can understand that. And Noemi, Daniel, and Michael really were outstanding residents. We're very proud of them, and they did excellently well here. And I'm sure that they're doing very well where they are right now. This is just our recent graduates, and you can see that Xixin Yao, which was one of our co-chief residents, he's right now doing sleep medicine. Dr. Weiwei and Dr. Atkinson are working just nearby in inpatient community. Very well prepared and doing an outstanding job. So let's look at how big is our program. So we accept 7 residents per year with a max of 28. So how much faculty we have? Well, we have about a little bit less than 60, 57, 58 is the number of psychiatric faculty, and that will include psychology and also addiction medicine specialists. Talking about diversity, again, just looking at this photo, this is their, incoming new faculty, and you can see Dr. Asiri came for child psychiatry, Dr. Arya Tanasiadi, she's our new CL attending, Dr. Leland Bird and Jasmine Shell for addiction medicine, Dr. Sharma for general psychiatry, and Dr. Porter Stott and Dr. Gay for the psychology program. So again, you can see that there's ample diversity, and this is something that we continue to stress and are committed to do. If you can look at the distribution, about 50% of the time that is distributed here is for teaching and instruction. There's a little bit of administrative, there's a little bit of research, and it's not that we do good research, but it's not as ample maybe as other major research program. This is not a exclusively research program, but it provides tremendous clinical experience. This is about service and clinical. Part of the innovations that we have been doing, we have a very strong ECT program, TMS. We are now embedded in family medicine. We are now embedded at a nephrology clinic. We're providing psychological services for neurology, among multiple things that we have here. One of our strengths is the area of neuromodulation. Our chair, Dr. Von McCall, and our vice chair, Dr. Peter Rosenquist, are national and internationally well respectable known researchers on the area of ECT and TMS and general neuromodulation. Dr. McCall is the editor of the ECT journal. So we really feel that we have a tremendous experience and knowledge on that area, and our residents enjoy that. So this is the amount of TMS procedures done last year, over 700. ECT by location, near 1,200. This is just last year. We also have a Spravato clinic for treatment-resistant depression. And in teaching, one of the things that I want to emphasize is that, and again, this is a great example of how we want residents to be drivers and co-participant of their own education. So we have an all Thursday didactic, which only 2 or 3 residents do not participate at any specific time on those Thursdays because they're covering service. So the rest 20-something residents will participate on the didactics without worrying that they are going to be called or having to put a progress note or having to answer any issues there on the floor. So they're exempt of doing that. And this has been something that the residents have asked for. Could we have a full day didactic session? And we love the idea, we run with it. And one of the things that we have done with this idea is it used to be in the past that PUI1s, PUI2s, 3s and 4s had different didactics exclusively for them. Although this sounds very nice, the problem that we have with that is that there is no sense of community. So one of the things that we have done is that everyone participates at the same type of the same didactic throughout the 4 years. We have a 2-year program that is repeated on year 3 and 4. And what this does is that helps to reinforce the knowledge that we are expected for you to have. Not only that, when you come here on your PY1, you're going to already receive didactics and training on CBT, on ACT, on DBT, on family therapy, motivational interviewing, and psychodynamic psychotherapy from year 1. So you're not waiting to your 3rd year that you're starting to do outpatient to learn the language of CBT or DBT or family therapy or psychodynamic. No, you're learning the language psychotherapy from year 1 throughout the 4 years. Obviously, psychopathology, pharmacotherapy, neuromodulation. We definitely give a lot of importance of the social determinants of mental health, which is basically epigenetics, and we know how important is epigenetics. The use of film as a didactic tool is something that we are doing. This is again some of the innovations that we have done. Uh, uh, so do we do research? Absolutely. You can see on the upper left side, that is Dr. McAvoy. Joe McAvoy was part of the CATHI studies, which are landmark studies on the study of psychosis and schizophrenia treatment. Dr. Lars Stippelman, which has been not only an advocate, but a researcher on the LGBT community and psychotherapy. You can see Dr. Rosenquist, the one on the extreme right. He is one of our experts on neuromodulation, TMS, and ACT. Dr. McCall on the lower left side. He is not only expert on the area of neuromodulation, but also an important researcher on the area of sleep. And in 2019, the American Journal of Psychiatry stated that one of his research publications was deemed one of the most important on that year on the area of sleep. Specifically, one of his areas of interest is sleep and suicide. You can see in the middle lower Dr. Brian Miller, and one of his area of passion and expertise has to do with the area of schizophrenia and inflammation, and this is part of the psychology group that does research on the area of psychotherapy. Again, this is we're doing quite a bit of autonomous nervous system research right now, LGBTQ, schizophrenia, TMS, and addiction research. Publications in peer journals, we had in 2022 79 publications, 9 abstracts, and 11 books and book chapters. So for being an institution that is not a primary research institution, you can see that there's a lot of activity going on here. This is part of what some of the residents have been involved just in 2021. This is a little bit of just a so you can see where some of the money is going, and these are nonprofit institutions like NIMH and DHHS, which is over $1 million of research funding. We have a child and adolescent psychiatry, a group in fellowship that is one of only 4 or 5 PPP programs. So let me explain you a little bit about that. That is what is called the Post-Pediatric Portal Psychiatry Program. So what it does is that it has pediatricians that have already finished their training, and they can be embedded with us for 3 very intense years and have their general psychiatry and psychiatry training, and are board eligible for that. This is supervised by the American Board of Psychiatry and Neurology. They have really been doing very well. We have several pediatricians and just general child psychiatry fellows. We have about 6 child psychiatry faculty, and let me tell you, those do not include me. I'm a child psychiatrist, and I help whenever they need me. But this is just the ones that are dedicated full time. This is part of what they're doing. They're very active, writing research, participating in national committees, and also doing national presentations. One of the things that we're very proud of is that this child and adolescent fellowship program has received the funding of the Emily Bowman Psychotherapy Fund. And this fund has provided the opportunity to do over 3,800 psychotherapy sessions as of 2022, being funded by them, especially for patients that are Medicaid. That Medicaid do not cover the psychotherapy part from a child psychiatry, but they can do it with this funding. We have an addiction medicine fellowship program, which received a few years ago over $2.6 million to provide and to really strengthen our fellowship program. This provides a great setting for general psychiatry because they can go to the Hope House. This is a very unique residential treatment program for women, which the fellows are embedded there. And also the our residents can rotate through there. Also, Charlie Norwood, the VA system, it enriches our diverse population, and you have the experience not only on doing just general psychiatry, but addiction medicine and even chronic pain. And one of the things is that, when you finish your training, you will be proficient in the use of MATs and medication assisted treatment, which I think needs to be part of that. One of the things that I'm also super proud of is that what a great advantage is to be embedded in a public education niche. What that does is that in our case, Several of our residents during their third and fourth year have wanted to do an MBA or MPH. We have one of our residents presently doing a master's in data analytics. And since we are part of the university system of Georgia, which the Augusta University is, that gives you access to other major universities like Georgia State, Georgia Tech, and the University of Georgia. So one of our residents, which is doing the data analytics master's degree, he's doing it from Georgia Tech. He's doing it completely online. And let me tell you the punch, it doesn't cost him anything because being part of us and we being part of the system is at no expense to them to do. They have this educational opportunity, so you don't have to worry of getting into more debt, but still get a quality education that can further your career, your knowledge, the things that you want to do. So I hope that this gives you just a brief summary of what we can do in our program. We really strive to provide a comprehensive biopsychosocial education. So you can see that we want to be strong on psychotherapy. We want you to be strong on psychopharmacology. We want you to have deep knowledge in neuromodulation, on medication-assisted treatment, and also understanding the importance of diversity, inclusion, and health equities. Participate in areas where our services are in need with a patient population that don't have a way to pay for that. And that's where we started today in our talk, talking about our free clinic. So this is part of a comprehensive way that we look at our education, and we see us in a mission not only to educate but to give back to the community. Thank you very much for your interest in our general residency program here at the Medical College of Georgia in Augusta University.